6:03 p.m. First up on the, I got to read the little disclaimer. This agenda is subject to change and includes those items reasonably anticipated by the chair to be discussed at the meeting. Not all agenda items may in fact be discussed, and other items not listed may also be brought up for discussion to the extent permitted by law.
Census.
And then I followed up that same evening, and surprisingly, the three I went to had nothing on the shelves. So, and then our regional tobacco inspector went out and has reported back that she found nothing on the shelves, and she also provided them updates on making sure they got our emails related to something separate, which is our hearing tonight. So that's been working out okay, but again, we now are in the process of determining, we again as town management and myself have been talking, and human resources, have been talking about two options. One is to hire someone. We have candidates we can interview at any time, which we may do for the town itself. And then I have calls into my fellows both in Framingham as well as Natick, the two health agents there, directors, to see if there's any consideration down the road of maybe regionalizing some of our tobacco control services. So that's where that stands right now.
And
I thought we did have a regional tobacco person that was
The,
on
there was a
that
grant,
serves our community.
there was a grant issued about 5 years ago
Uh-huh.
to about 9 towns. The money has pretty much run out. We're down to hundreds, if I'm not mistaken. So that grant's gone by the wayside. The intent of that grant was to get these 9 towns to consider regionalizing a position. So we're at that point pretty much. And it was issued by Metro West Health Foundation for that purpose, to get some regionalization consideration of sharing services together. Some towns, such as Ashland, went forward, and we have a revolving fund for our tobacco fees that are collected. So we collect the sufficient funds needed to hire someone on our own. But the whole concept was that every town would consider updating their fees to that $200 to $250 range per tobacco permit issued, so that it'd be equivalent to keep the program moving. Some towns are down at $25 to $50 a permit, and that funding isn't going to suffice for the needed services. So we're still in works. The works now is to maybe consider the towns that have produced enough funding to provide for a regional inspector.
No, the question is, the revolving fund does not eliminate regionalizing it. It only keeps the fund in a place, rather than, it doesn't eliminate regionalizing the service. Okay.
No.
So they're two
We
independent
can still have an
processes.
inspector.
Yeah. Okay.
It would be more efficient if we had a regional inspector and a regional program, but at this point, we can still hire someone. And it may be that once one fellow's on vacation, the other one, I called him 2 days ago, he hasn't gotten back to me. I'm gonna try to reach him by email to see where, he was the one that was, Natick Health Agent, was pretty much the fiscal agent for this grant that we received. And so I was wondering where he stood on what his concepts
Yeah,
might be.
but we've been talking about regionalizing all other services, but if we can make one at least feasible one, this
Yeah.
one, without any issues, then
It would
maybe
be-
this may be an exercise for us to move forward with other services that
It
we
would be
want.
nice. This is
So there may
exactly
be- So
the-
the
the
funding, whether
applicant.
it's revolving or non-revolving, it doesn't make any difference to regionalize it. Incidentally, on the new governor's order, I overheard on the radio that the Andover is going to, Andover or some other town in the northern area, that they wanted to go and extend it beyond there, so they want to promote their own regulations to extend it beyond the 4-month period.
Yes.
So that's why I was trying to reach you to see whether you can reach out to them and get some information about it.
Andover?
So, and I think it's Andover.
Can I
So
go,
if that's the case, sorry, if that's the case, that we may want to think about it in the future and then work along in the same lines. Sorry, thank
that's
you.
okay. Can I go back to the grant? So there was a regional grant, and there was somebody that, is that a year ago, Mark? How long has that regional person been doing this job?
Oh, we've had a regional person, probably 3 years ago, 3 to 4
Through
years
this
ago.
Metro West Health Foundation?
Actually, our tobacco control agent was one of them.
Okay,
He was the first one. And then there's another person that came in to help, and so we have 2. But both of them they understand the funding is down to minimal amount of money.
wait a minute.
Actually, yeah,
I guess
so
we're
the
talking about two
funding
different things.
for the region, I should say.
So the Metro West Health Foundation funded,
That's
not
correct.
Ashland,
That's correct.
funded this person that
Yeah.
worked in our region. We were
That is correct.
one of her 9 towns.
His and
His?
hers, 9.
Okay.
Her and his.
So that's been going on for 3 years?
It's Elliot Brown, and the other person's name is Sarah, and I can't think of Sarah, LaRue.
So, how long ago did they get this grant?
I believe it was 4 to 5 years ago.
Okay, so
And
that's
so
been
it's,
around,
it was a 3-year grant.
okay,
So Marty Cohen, the director of the Metro West Health Foundation,
okay.
allowed us
And-
to extend it 1 additional year. So we're almost past our extension. We are past our extension.
What other services have we as a town gotten from them?
They did training in town.
Or what?
For the tobacco vendors. We were trying to get a school component for it, and unfortunately, it's hard to find people. We had an educator who was interested, but she didn't last long, and unfortunately, she went away. Because the idea was to use some of this money to get into the schools.
Okay, so the only thing that they've done for us in 4 or 5 years is training some tobacco vendors?
No, they come out and done inspections.
Oh, okay.
See, Elliot was also working for them, so he didn't charge for all his compliance, I shouldn't say inspections, compliance checks, which would be,
Who's Elliot?
Elliot Brown is our tobacco control agent right now. He's pretty
Oh, I didn't
much,
think we had one.
yeah, we do. We've
We had
him.
one, and I think he resigned, I believe.
Yeah.
So,
And so who's Elliot?
Elliot, you probably haven't met, but he has been at our public hearings to represent issues
Yeah,
with
the
people
town
so
At our last meeting, you mentioned he took back his
Yeah,
resignation.
and
Was
then
that settled?
that's all being handled by HR, Human Resources.
Okay, so is
So
he
that-
officially our tobacco agent again?
Right now, we're saying to him, it's cleaner if we just use the region while we have a little bit of funding left and
Okay.
start the interview process.
Okay.
If we're not gonna go regional, as a group, putting our own funds from each town into a pool, then we will have funding available to, and we're starting to already, we've been talking to Human Resources about
Okay.
the applicants. We actually went out and advertised, so
Even if
that
you-
was the
Okay.
decision.
even if you put the fund, that'll be a regional agent. That's what you're talking about, right?
That would have to be a way, we would have to figure out the formula, like if you have,
Fine, but those are all nitty-gritty aspects of how to handle the money. But essentially, the service is going to be a regional service
No.
by somebody,
not yet, no, that
if
hasn't.
that happens.
If it happens,
Right.
then it
So
will.
that has, the two
That's
aspects of
why
having,
it's like
having an agent who serves
Yeah.
many towns is one aspect of it.
Yeah.
How we fund it, what we do is another aspect of it.
That's correct.
That's, okay, so that they're not
Or we have
dependent
our
on
own,
each
it's one or the other, and right now, the situation exists that we start looking for our own person to do our town at this time. Who knows, that person may be the person that decides to work and try to get work in the other towns, and who knows, it may be regionalized, which would be a perfect concept.
Mark, I'm sorry
Yep.
if I'm still confused.
I'm sorry.
So you said we have somebody, so we had 2 people, one resigned, and we had another
We
one?
only had one.
No, we
Oh, we
That
only
one
had one.
person was Elliot Brown.
Okay.
Elliot also worked for the region.
Okay.
I think post that funding, there was only one. Until that time, there were 2, when the funding was up.
When the funding almost went down to like hundreds, the services weren't there, but they were trying to just clean out the funding, they being Jim White, the fiscal agent from the Natick Board of Health, the health agent. With this that came up, there was enough funding to get this person out to help us out last week.
So we have been having only
person being
one
Sarah
person for the
LaRue.
past 3 or 4 years, if I recall. Is that right?
Yes, that is, it's Elliot Brown.
Elliot Brown is the only one that I have seen coming here to the
From the
board.
regional.
No, this is, he's a part-timer, he's a
Is he the
part-timer.
one that resigned from here?
Yes,
Thank you, that's all I'm trying
Oh, okay.
to, okay, same
Sorry.
person.
he's a part-timer. he
Okay.
resigned.
Mark, didn't you also say that, just before we prefaced everything by saying that the money that we collect in fees for the licenses per year would be enough to carry that? I mean, that's $4,000, but,
Yep.
so we can
The-
still
the
do
pos-
it,
yeah.
we can still have our own,
Yeah,
right?
exactly.
Or-
The
or
position basically is a 60-hour average position, a year.
For 9 towns?
No, for Ashland.
Oh, okay.
I'm sorry, we're talking about Ashland right now,
Right,
that position.
It's
And
a
with the
part-time
revolving
position.
fund in Ashland.
okay, so that's where that money
Yes,
goes and
yes.
can be taken out of, okay.
Okay.
Thank
There's
you.
different scenarios. I'll update the board as I know which one we're gonna take. So, and that included the temporary ban. I think I updated all 3,
Okay.
I
Just
think.
continuing on the temporary ban, I have a personal comment that I'd like to make just to our board, just to congratulate everyone here. And let's give a shout out to our old friend John Featherston, who was on the board when we started doing all this work, a while back. And a lot of people came down pretty heavy on us. We had lawyers on our tail, but we fought for what we believed in, and we ended up, we were right. We were pretty right about this. So I am pretty pleased that the governor decided to take action. And I'm pleased with the work that we've done together as a board and will continue to do. And then there was a letter that one of our members of our select board, Brandy Kinsman, had written to Mark
Yes.
earlier. And I'm going to just read a couple of pieces of it. It'll be part of the public record for anyone out there that may be listening and wants to see the whole letter. I'll give you the gist of it, and then maybe we can talk a little bit about the board. It basically revolves around the decisions at Every Turn Coalition. It happened last Friday. Senator Spilka had given some opening remarks that included the governor's vaping ban, which she supports. At the end of her remarks, she mentioned that if anyone had comments or questions, to feel free to reach out to her and her office. And given the Board of Health's strong stance on vaping and tobacco products, that she would like to suggest that we as a board write a letter to Governor Baker and to Senator Spilka in support of the ban, and also mentions that she will be bringing this up at the Select Board meeting in her board report, and that if the Board of Health wanted to pursue a joint Board of Health Select Board letter to the Governor and Senator Spilka, she would help facilitate that and pursue that. That's the main gist of the letter, which will go on the record of this meeting if anyone wants to read the entire thing in full. So I certainly think the idea of a joint Select Board and Board of Health letter would be great. I don't know, do we need to vote on something like that?
You should.
Okay.
You should.
So I move that we, as a board, pursue writing a joint letter with the Select Board, and if the Select Board decides they didn't want to, that we would write one ourselves to the Governor and Senator Spilka in support of the ban.
I second that.
Any discussion? All in favor?
Aye.
Aye. Judy, anything? Opposed?
Abstain.
Abstain, okay. So we have 3, 4, 1 abstention. Thank you. All right, next up on the agenda is listed under the chairperson's report, the Regional Nursing Service. Our chair, Diane, is not here. Mark, did you have any information on that you can share? Or did you want to put that off until our next meeting?
I can update the board a little bit. The health director in Framingham sent out save the date type of email to discuss this in further detail with the city of Marlborough, town of Holliston, town of Ashland, city of Framingham, I think maybe Hopkinton. And it's related to getting us all in the same. Framingham came here about a month ago, sat down with us, the Framingham Board of Health chair, as well as the health director, Sam Long. And we chatted in general about combining some shared nursing services, as I mentioned with the flu clinic. Now we're going to try to combine the other towns that may have interest in sharing nursing services, since Framingham has a a new clinic on the center of town and has a lot to offer. So they're trying to get towns to join in on shared services. So we're planning to meet, excuse me, next Tuesday afternoon at the Metro West Health Foundation conference room. Believe Diane's going. I'm going. I actually sent Diane an email today asking if she needs a ride, and we'll see. We'll have a better report after that meeting.
All right. Next up is Health Agent's Report. I know you're having a hard time talking, and we're making you talk the whole time.
That's okay. The cough drop's working, and they're there for anyone that would like one. You have our budget in place, and excuse me, and you also have updated revolving funds on the other side, which was good. Laura and I both worked with our financial person to get this information. They've updated our line items because the available budget was not mentioned in our previous reports. It takes some time to forward it over to the next fiscal year. Carol downstairs with the financial director did that for us, and so you now have those lines in order, as well as you can see.
Which ones are the revolving accounts here?
They're on the second page, KG.
What's this, page 1?
Yeah, I'm sorry, it's the back,
Page 2.
this back page here. This page here, yeah, exactly.
And which item is that?
So now you have available budget line items that were different.
Revolving.
So when you look at the available budget items for the food program, the last two line items, the food program and the tobacco program, you can see we have funding in those to pay both for our food inspector as well as tobacco control. And these are derived from revolving funds from any fees we collect for food establishments, as well as any funding we receive from tobacco permits.
Tobacco. Okay.
And as we know, we can't collect the funding from the fines. I think we talked about that prior. And the front page is just the general budget in good order. I like to bring up the budget at each meeting in case there's any questions. So if there's any questions, I'd be glad to help.
Yeah, but they said that the summary report that I wanted, if I can get that, that would help to put up a good argument for getting additional food inspection services.
That's correct. You'll see the funding in there is 30.
Funding is not done. Looking at the summary report, which the 2 years we needed, 2018, 2019, July 1. So if we can somehow get it for me, that'd be good.
You're looking to get additional funding for it, KJ? Yeah, it's.
Argue with the town
Yep,
to get beyond the revolving fund, so they can't just tell you, go and look at the revolving fund.
understandable.
Revolving fund is only a safety device. It doesn't say that you need to only look it from there. You
Yep.
can take it from outside.
Yep.
If the town goes under, then the revolving fund is there to do the inspection. That's what the purpose it was designed to.
Pitbull of funding, KG.
I know, I was told, they shouldn't choke the food inspection service, that's why they created it. So if there is an issue with funding there, they take out money from here, then your inspection service goes down. So that's why they created the fund, that revolving funds. So it does not necessarily mean that we only need to take it from there, we can get extra money from elsewhere too. That's where we need to look at it, so we need to,
But we're sure of
Fight it
this.
out.
But
We
we're
should.
sure of this.
I'm sure of that, we're sure of that, but
Right.
Well, maybe then what
you
could
know,
happen.
we have positive thinking is that good inspection provides good tax money for them, meal
Right.
tax money.
Right.
And it's always good to have a healthy community with better inspections.
Right.
If somebody doesn't want it, that's a different issue. So if you can get those two reports,
You should have received, you're talking about the food inspections?
no, he gave all of it, is not the one that you normally submit to the Department of
Well, that
Health.
report format changes every.
That's fine,
so
but use the old format and
use-
give me the data,
yeah,
that's
we have to
fine.
take that data now that you received and transfer it
Whatever it
into-
is, but you take the old
We'll
form.
take the most
old
recent form, yep.
White out those numbers
Okay.
and put new numbers, that'll be fine for me.
Well,
That
I'll
way it's
see if we
easy to
can-
compare
And
and
you
work
know.
things out, yeah.
I'll see if we have it in PDF. We might not have to white out, but we'll see.
White out.
I have a question that might be a little off the track, but when you go to California, outside a restaurant, they get a grade from their inspections. So you only walk into the ones that have an A outside, because why would you wanna eat in a B or a C?
Even some of the towns here do that too.
And I'm wondering, like, wouldn't that be great? Like,
It
To-
is possible here too,
what
but
does it
usually.
take? Is it labor intensive?
No, it depends on
or-
what do you want to do that, because if you grade it based on the inspection reports,
Uh-huh.
you could tell them how many times they failed or how many times the inspections
Yeah.
have not worked out. That's one number. The other number is the number of hours of the anti-choke versus the number
Yeah.
of hours they work
Okay.
there. So that gives you how well they keep
Right.
the
Staff.
institution secure for
Yeah.
people.
I thought it
All
was
of these
wonderful.
numbers could be good.
That's
Plus,
interesting.
the number of hours of the food inspector, certified food manager, so that's also will be
Be
a good
interesting to
measure.
know what the criteria
Have you
is.
never seen it?
Well, not here, but I think there are some in Boston or Brookline, one of these
Are there?
cities have it, yeah, they
Yeah.
have it.
It's very neat. You feel
It
very
is.
safe going in there and eating, even if it's their criteria. Anyway, just thought
Yeah.
I'd throw that out there.
Diesel fuel, the diesel
We-
fuel leak.
Had a report from, what happened was the DEP contacted us about a diesel fuel leak at the Verizon cell tower up, now I forget the name of it.
So last
Yeah, up near the
meeting
Framingham
it
line.
happened, right? The day on which the last meeting
Yep.
we had, yes.
Yep.
Okay.
And what happened, first of all, is the They had their crew members up there when I went up, and DEP was there as well as the cleanup company. They have a generator, and within the generator, on the base of it, is an oil container, diesel fuel container, which is surrounded by a tank, what do I want to call
Like
it?
a containment
A
pan?
containment,
tray.
a containment tank, actually, around the tank. It's almost like a big tub.
Oh, okay.
But what was going on was the oil leak wasn't happening from the diesel fuel tank. It was happening from a line that goes up to the generator. It was spraying out diesel fuel. And it was hitting the sidewall of the
Pressurized.
encasement.
So it was kind
It was pressurized and then spraying out and dropping down the side of it, which was past the containment tub. So that's how it got on the ground. It was on both sides. It was just spraying all over. So they didn't know how many gallons escaped, but they saw the staining on both sides of the generator. So when I went up there yesterday, the gates were locked, so I couldn't get in. But on the outside was some plastic with maybe about 4 wheelbarrows of soil. So maybe it didn't get too deep, and maybe it wasn't too much. Hopefully they caught it in time for their sake and actually for the benefit of the environment. So, but it was unique. So now I have a feeling they're going to start putting sensors
You
on
should
the
apply-
sidewalls.
You should apply for a drone contract. Send the drone up and then watch.
They
But-
do that with water towers.
Of course.
Yeah.
They caught a fugitive who was sitting in a cave in China.
They what?
They caught a fugitive who was sitting in a cave in a remote forest with a drone. For 17 years he'd escaped.
Terrible.
So you should get one of those tiny devices with a camera, so it's easy for you to inspect.
I will ask that you put that in the budget for me next year.
It's pretty simple.
You'll donate that, right?
Yeah, it
You
does
gotta
not-
go with me when I ask.
Doesn't cost more than $100. So you don't need a technically savvy one. You just have to see what is there.
Understandable. I'm not arguing that
You
one.
want it? You want it?
I gotta learn how to use it, but
No, it's simple. Come on.
if I cause accidents,
It's
If
a
it-
tiny one.
if it drops down on the street and someone gets in an accident,
It's a tiny one. Nobody will get into accident.
so.
The toy.
Do they use them on the gas line in town? Drones? No?
It'd be interesting to see. So,
We got up next is the update on the Massachusetts Environmental
Yep.
Health Association Conference.
yes, so I was able to attend what I thought was a really good conference. They had a lot of different subject matter there. One of the interesting ones is an up-and-coming issue is silica, derivative of granite and so forth, in a dust powder. And when you have people out there working on construction sites, if that starts getting in their lungs, there's concerns, just like asbestos, no different. So we had someone from the OSHA, OSHA, the federal OSHA, who spoke on that. And also she was talking about trench safety, because industrial accidents and preventing air pollution is kind of what we do too. We're the first to know about them. Usually OSHA will come in, but we do get dust complaints now and then on construction sites, and it depends on what they're doing on that construction site can make a difference. It's not dirt or sand, it's the silica that comes from granite and rock, basically. So if that gets powderized, there, people should, especially people with jackhammers, should have masks on. So it was very interesting.
Isn't that the same substance that's in those little packets that come with electronic devices to help keep moisture out?
No,
and
no,
sometimes
those are
people choose?
bigger crystals. These are talking about fine dust.
That's a
particles.
fine
Okay.
dust
So
particle.
that's
But I'm
silicon
gonna,
dioxide is just sand.
I was thinking that same thing.
I'm gonna look at that.
Or things that come in.
No,
Yeah.
those are
tubes or-
crystals.
yeah.
They're the crystals.
Yeah.
Okay. And then another one was climate change. We had someone speaking on behalf of Chatham. He was brought in for a review of what they're going through down there at the outskirts of Chatham, where the east side,
The break?
yeah, they're losing the wall. And they showed pictures from the 60s, the 70s, aerial pictures, probably from a drone on the newest ones, and how it's all changed and the flows. And some houses were flood ready, they were in danger of flooding. Now that may have changed, and houses lower are. So very interesting how with all these horrific hurricanes we're getting, how it's changing the area, as well as this small but noticeable increase in sea level. I thought it was very interesting, because right here we see climate change issues with mosquito-borne illnesses. We see it with heat stress. We have shelters now in case we get in the heat stressed days and so forth. So it was very interesting to see how they're being affected in Chatham in a different way, being right on the ocean. And even you all saw cyanobacteria over at one of our reservoirs. Again, it's caused by the water warming up. So with these additional issues, requires additional engineers, public health, and layers upon layers of people to try to resolve the issues that come from it.
So I think this, Columbia had 90 degrees or something, they closed the schools today for 90 degrees.
Where?
Columbia.
They closed the schools, and that came up here at KG. I think you were on the board, weren't you, when we were dealing with heat stress in the schools? And again, that was a combined effort with the superintendent, our chair.
He came up here this year.
Yeah. And then another area that was interesting, I thought, was the person from the town of Brookline who used to work here as our planning assistant, Karen Martin, presented what we do here now, and that's how to involve restaurants, new restaurants coming into town with not just the Board of Health, but your economic development coordinator and planner. Karen Martin works for the planning department, and she presented various aspects and benefits of having those departments all together. Unfortunately, we have rules and regulations, but at the same time, we can all be thinking on the same area of what will work best maybe in this area. And they were showing how in downtown Brookline, they're looking at more seating outside to make it, and even seating outside of maybe places that aren't restaurants, but where you can have your lunch. So it was very interesting how that we all interchange, which we do here too. We're constant. That's why we're all up in the second floor. We're always constantly dealing with new applicants on mostly restaurants in our respect, but other projects as well. So I thought that was interesting. And there were a couple others, septic updates. We had our key person there who helps us out here in Ashland. She's from the Northeast region, Claire Golden. She's an expert in septic systems. Gave us some ideas of some newer techniques being used and what to be on the lookout for. And then we had someone from Falmouth who presented information on new innovative technologies being utilized. They're actually finding out different ways to remove waste. Incineration was brought up, which they said is used in other countries, but when you incinerate, you have issues of odors, and you have to put the pipe above your roof higher up into the atmosphere so it doesn't affect the neighbors. But it is a clean product at the end, where other innovations don't always leave a product that is final. They have products out there, they call them compostable toilets. The problem with the compost, it's reduced, but at the same time, it can't just be spread anywhere. It has to be treated. So that's why they're looking at other areas of how to treat waste. We'll get there. And then I attended a pool safety class, which was held by the Department of Public Health, the various members of DPH that handled pool regulations. It was very interesting. It was a classroom for about an hour, and then at the place we stayed at had a pool, so we went out to the pool and actually conducted. We had 3 groups or 4 groups. We were conducting inspections and so forth. So, and you can have that if you
Did
like.
it pass?
Yes, it did. What was it that, there was one item there, though, that, it was interesting. They were going to look into it. I felt bad for the hotel, but they had rooms that faced the pool, and they had fences about gates, like wooden fences that were about this high. And one of the people in my class, in our group, said, couldn't a kid get over that? So they're going to look into it, see if they need extra precautions, because their slider door goes right into the pool area, minus that fenced-in area. So who knows what will happen with that? But we were there as a group, and all good things hopefully will come to fruition on that. Hopefully they'll look at it and see if they have to put risers on those. But if I can, I know I keep promoting it. I've updated the Massachusetts Association of Health Boards website to make sure you're all included. So you should be receiving updates at this point from MAHB. Judy, I don't know if you were on it, so I made sure you were. Okay, you're getting an email now. Good, good. I'm glad you are. And they have a great conference. You can either go to Taunton or Marlboro, and it's the beginning of next month, I believe.
Sounds lovely this time of year.
Oh, I know, I'm just saying. KG's been to them, and
I never got a call back from Shel Sabaro, though.
You never got a call back? No? Well,
I'll send a message to Marsha Bene, maybe she'll push it.
or go to the conference and catch up to her right there.
Oh, she's very busy there, I can't catch up to her, you know.
No, but, I always bring that up because I think it's very beneficial
I'll
for the
send it
board
on.
members. They have a, Board of Health Member 101 course for new members entering, but if
good.
you can, they're on Saturdays, but they're both on Saturday. And you can go from 9 to 4, or you can go 9 to 1, whatever you prefer. But if you do want to go, let us know. We have the money in the budget to pay for it.
Okay,
Okay,
thank you.
you're welcome.
Triple E.
Triple E, you've been seeing our situational awareness reports. Again, many thanks to Laura, because, I say, Laura, we gotta do one today. It's every Monday we do a situational awareness update. And she'll take the data that I may be providing her and adding it to it and editing it and doing most of the work. So thank you, Laura. And it's been approved by town management to the point now they just say, just post it. They trust what we're putting out there. So we posted situational awareness number 9 yesterday.
I just want to thank both of you. In my community, that's now on your distribution list, they are sending out every time you send them one. Our whole,
That's fantastic.
every 78 houses on my street
So good to hear.
gets the report, so it's working.
Well, we appreciate your input as well.
To all you folks in town that watch these meetings, if you're passing by Town Hall, stop up, say hi to Laura and thank her. She does a lot of work.
Give us your email address.
Yes, we'll take your email.
Yes.
And sign up for Red Zone or whatever it's called, which is Ed Berman when he sends, Code Red, because
Code Red.
when he sends out the messages, he says the problem is for the newcomers to know that if you go to our website, right at the bottom right side, you can sign up for Code Red and you'll get the messages.
Yeah.
Or emails if you wish.
Yeah, that's a really good
Yeah,
thing.
it really is. It's so important. The board might, you have in your packet the cremation form, as they call it, for unclaimed bodies. What's been happening is, and you may have seen it on Boston TV, WBZ, featured a funeral director out of Worcester, who unfortunately, in my view, has a good heart. He really wants to help people. He actually has been controversial in the past because he took the body of the, what was he called, the bomber, the marathon bomber.
Okay.
Yeah, and he took a body, I can't say body, he took remains from Ashland, from one of our nursing homes, before he had this filled out, this cremation form. The law says, and we've had our town attorney look at it, is that you have to have the remains in the town to be able to sign this. This form is when there's no family members involved. What we have to always be careful of, though, is that if they're not for sure if there's no family members, and then if one shows up to say, my religion doesn't allow for cremation, there could be liability. That's our town attorney knowing the liability issues. But we've been in conversation with Worcester, because that's where the remains are right now. And Worcester is confused if they should sign it or we should sign it. But the problem is, we didn't even have a form. So Worcester shared their form with us, and this is just an overlay of Worcester's form into ours. And what I'm asking for the board to do is approve this conditional to our final approval from town attorney. So we'll at least have a form in case, because now we have nursing homes in town. We never had a hospital. We may see more deaths in our town because
What's the
of
legal
that.
definition of unclaimed? You know, how long before?
30
it's-
days is what
30
I read,
days.
yeah. So, and that person was transported out of our town mid-August, so around mid-September, the funeral director sent us a request to sign, and that's what started all this.
You know, if
So-
the death happens in Ashland, that's when this kicks in, or
If,
the remains stay in Ashland?
if the remains are still here, if they're not still here, we can't sign it. That's
how
the
do
way
they
it's worded.
How do they stay here in one of those kind of, the
Well, we would,
funeral homes, they put it in a
yeah,
ice box and keep it there?
that's one place, or the Yeah, that's about the only
Forest.
place, KG. That's about the only place.
in Ashland. So they hold it for 30 days, nobody comes forward, and then
They would ask the burial agent to sign this cremation form, and it's,
who's the burial agent?
well, it's multi-jurisdictional. It can be the Board of Health agent, it can be the funeral director, who it is right now, because he's always available and he usually gets the bodies, or it can be the town clerk. Right now, it's, the three of us kind of, we've always appointed the not always, in the past, say 15 years, we've appointed the funeral director because he's right there when the body is, the remains are available.
Mark, how many unclaimed bodies do we have in a year?
This is the first I know of.
Oh, okay.
But again, it's coming from a new facility in town that handles older people's needs.
So sad.
Yeah, and I expect we're gonna see more. Because normally, I would think that in most cases, if the person is close to death, they probably send them to the hospital, so Framingham probably gets quite a few. But now we have a skilled nursing home here where maybe they try their best before versus a hospital. And I'm not an expert in this, but that's what I think's happening.
Yeah, awesome.
Hospice.
Yeah, hospice could be another case, yeah. In most cases, the family takes care of it.
Right.
So this form, if somebody is here in town for 30 days and nobody steps forward to claim them, I'm sure there's a process to try to find somebody, then we can ask a cremation facility to cremate that body for us,
Well-
and then do we get the ashes back into Ashland, or what
Well, this
happens
is
to
how it
that?
happens, is a funeral director or crematory has to accept those remains. We're not responsible until the crematory or the funeral director accepts the remains. If they do, then it's our job to sign the form. Either might it be the three people I mentioned. But we're not, because there's a stipend involved, but you have to be a funeral director to get that stipend. The state has a fund for non-family type people
Oh, so
without
the
families,
expenses are
people
meant from
without
somebody
families.
else, not from the town.
Yeah.
Like, not the town's burden
So,
to financially.
exactly. The funeral director got a stipend to take the body and moved it out of town before asking for anyone to sign this. I'm sure our funeral director would have been aware of this and used some type of form, even if it didn't have our letterhead on it, so.
But if this is a new form that's coming into effect, I think we should probably notify them to be aware of this new
Yeah,
form.
yeah, and we have talked to Mr. Matteries, John Matteries.
All right, if I may be allowed to make a motion that we approve this cremation form that has been presented to us by Mark Oram, our health agent,
Contingent upon
contingent
legal
upon
counsel,
the corrections by the
Town council.
town council.
I would say changes and approval by the town council. You know, you're the first approval, she would be the second.
So modified.
Okay.
I second that.
All in favor?
Aye.
For
So this
nothing?
cannot wait.
No,
I need to take a bathroom
makes
break.
me sad.
Okay.
I'm drinking a lot of water.
I'm gonna move that we take a 5-minute recess. Yes.
I second.
Everyone okay with that? Approve? All in favor? Aye?
Aye.
Okay. Welcome back, everybody. We are back from our break, and we are going to take we're going to make a slight modification to the agenda, or propose one. I'm going to move that we move item 8 to the current spot to give us some
I
time
second that.
to head. Anybody discussion? All in favor?
Aye.
Aye. Okay, so let's take a look at the minutes from the last meeting.
I have a question on it.
Okay, so do we move to accept them first and then take questions, I think? Would that
You
be-
can motion to accept, and then you can open up the discussion.
Okay, so do we have a motion to accept the minutes?
Oh, so,
Yep.
yeah, is she done already, or?
Well, we're
Oh,
gonna,
The
and
question
then-
is for this minutes, or the question is for something else?
For the minutes.
Oh, then we can't accept it.
well,
Well,
okay,
you
just wanna make sure
open-
that we
Motion
move to accept it, and then open the
discussion.
conversation before we
Oh,
vote.
that's, okay,
Okay.
motion to, yeah,
Okay,
so
any
moved.
second?
I'll second it.
All in favor? Aye? Okay.
No, no, he
No,
wanted
No
discussion.
discussion.
Oh,
She has some
no, no,
correction.
move to- Oh, no, no, right, I'm sorry.
So they just.
I'm
moved
new
to-
at this, folks.
Yeah.
This is only my second time doing this. Cut me a break.
Not yet.
Okay, discussion.
Yeah.
Sorry,
Um,
Judy.
So I just want to make sure that the minutes are correct. Not saying you didn't do a good job, Laura. So, under the tobacco control agent position, Mr. Orm said that the resignation has never been made official, nor had they started interviews. He resigned, he sent a letter, because I remember reading it. So what do you mean that it's never been made official? I don't remember you
He
saying that.
was, I don't know if I explained it well enough, but he said he would handle and carry over until we found someone. So he was, the
Had he
paperwork.
done anything between the time he resigned
Did he
and,
do anything?
no?
Not that I know of.
Okay, so he
So,
resigned.
and now it's kind of like the town said, best HR is dealing with management and saying, it's best just to try, that we had the option. If we didn't have the regional option, we would have been kind of carrying him over until we had a new person.
So,
But I don't remember you
once,
saying that,
once people resign,
I
that
ca-
doesn't become official?
yeah.
He rescinded his resignation, so when he resigned, the agreement was, because it was taking a while to get the process going to find someone new, and we told him at that time, you can hang in there, we'll keep you until we find someone new, and we're in the process of doing it. And if I didn't explain that properly, that's what exactly happened
But we
with HR.
didn't use him between that
But we
time
hadn't
and-
used them, no. We were planning to, but then management said it's best to, NHR, to just continue with our review for a new person, get that person, even if down the road we someday regionalize. So I'm working with human resources right now on that.
So when somebody resigns here, who accepts it?
That would be HR, human resources, yeah. And so what they call it, an action request form didn't go in because he was carrying over services until we could find someone. And again, it's a 60-hour-a-year position, so it was more like an emergency coverage type thing. There was even the discussion of hiring someone new and keeping him on call in case one person's not available, like what just happened last week. But now it's pretty much clean. They
Yeah.
pretty much said, let's just go this route.
I just don't want this part of the minutes if this, I mean, and because it said, Mr. Orm said the resignation has never been made official, but you did make it official to our board, you gave us all a
Yes.
copy of the letter. So-
Official within the Human Resource Department, if you
Alright.
want to add that.
Well,
Yeah, I don't know if I said that, but
you,
that's.
yeah, you didn't, so we shouldn't put it in the minutes,
Yeah,
right?
no, I wouldn't, no.
So can we strike, Mr. Orm said that the resignation has never been made official, nor have they started interviews?
I would ask, did I say because of? I don't remember if I told you why, about the carryover, like I just explained. If I didn't, it'll be in this, if
Well,
I didn't, it'll be in this
yeah.
week, this minute,
but-
so it doesn't really
Yeah,
matter.
it's confusing, I think, because I just want to make sure we're reading what happened. So, you noted that he spoke to Human Resources Director, and they're waiting for him to rescind his resignation in writing, and he may be back on track with us, but we need to follow the process.
Yeah.
So,
Would you feel better if we didn't vote on these minutes tonight and checked the transcript?
oh, could we? Yeah, okay, I'll watch the tape, yeah,
And then we
Okay.
can vote on them next week?
yeah.
That's
Can
fine.
we do that?
And what's nice is this discussion clears up any,
Right,
in case I didn't mention
Right.
why. you
Okay.
know. Sometimes with personnel, I'm limited to what I can say and so forth.
Mhm.
That's another, I may have been shot versed on this discussion.
okay. No, I just wanna, like, I don't wanna,
Okay, so
Understandable.
let it go on record that we're gonna withdraw voting on the minutes from our last meeting so that we can review the transcript, and we'll vote on that at our next meeting.
That's fine. As long as that, you need an accurate reflection, and clean reflection. Okay.
Okay, we do still have 5 minutes before 7 o'clock, so I am going to move that we bring agenda item 9, discussing future agenda topics and future meeting dates to now.
okay?
Yeah.
You want to second that?
I second that.
And all in favor? Aye. That passes, okay, so, our next meeting date is scheduled October 15th, and then the next one after that is November 5th. November 5th is Election Day, isn't it?
It is,
So that we can't meet on that day.
That's
right?
correct.
So
it
we're not
is. I
meeting.
don't know if I'd have to ask Tara. I won't be here.
Mhm.
I'm off that day.
I mean, technically, first Tuesday in November.
Yeah,
So-
and I'm not for sure if the state has elections, but
Okay,
yeah, I won't be here if you want me here. I can't be.
okay, so the
That's
15th
when the primaries happen, or what?
and
I
then the
don't know.
19th.
Usually it's cities. I don't know if the town has any elections that day, but it might be, it's up to the board. I mean, I can send you my notes if you
No,
need them
no
on that
elections
day.
have been scheduled by the town as far as I know. Our
Yeah.
town.
We'll certainly have that information by the meeting of the 15th, that we know that. We know that on the 15th, we're going to take our vote on the tobacco regulations. And we may have Ed Berman speaking,
Yeah,
and we'll look at that fee schedule as well.
Yeah, and Ed just, is going to, he wanna know the time period, and the last time he was here was this year, at this time, October 2nd. So I let him know the time periods from the last time he was here through this month, throughout this date.
Are you looking for some topics?
If there's any that you have,
I have two.
okay.
So if you look in the draft of the minutes, you see that I've been inquiring about the air quality work at the Warren School.
Mhm.
I'd like an update on that. And I think we should talk about Halloween, because I don't want to ruin anybody's Halloween. And if Triple E's still around, who's going to make a determination for the kids?
That was the middle school, you said, the air quality?
Yeah, well, no, it's the Fruit Street School, Warren.
Oh, the Warren,
Halloween
okay.
has only 2 E's, I guess.
Okay, so
I'm
we can
sorry?
put those on the
Halloween has only
agenda.
2 E's, not triple E.
Yeah, if I may,
Oh, there you
Mr. Chair.
go.
On the air quality of the
Excellent, very
school,
good.
usually when the board has dealt with the superintendent, and we did it with heat stress, it would be either the chair or the vice chair communicating with the superintendent on any requested items. So I'd suggest either the chair or the vice chair send something to our superintendent, asking for an update.
Okay.
That's just formality. It's pretty much how we've always handled
Right,
it.
right. Yeah, and
I don't mind doing it, but it's a formality
Yep.
type thing.
I'll do
reach out
that.
to-
I'll send Jim an email.
Thank you.
Mark, if you can reach out to Andover or North Andover.
Yeah, I have it on my notes to do.
And then if you can get an update
Yeah,
on
it's
it.
right here.
And if you can by that time get that, somebody of the food report, that will also.
I can't
help me.
promise that, but I'll try.
That should
you know.
be easy for you, come on. It's a one pager. Are you kidding?
We have to put the data in the columns.
One pager.
You have to break it
You
apart.
finished that last time in one day, so
I
you
will
should be able
promise to
do it.
try. I got it on my
Yeah.
report from the
Just-
state.
Just
on
blow
food
away the
inspection.
mosquitoes, they will go away.
I'm gonna give it a try.
Yeah. Only 2 years I'm asking, not much.
Oh, you want 2 years
Well,
now?
last year and the previous year. That's how we know the trend.
He's a data guy.
I respect it. I respect it.
We're just seconds away from 7 o'clock. And it's 7 o'clock, so I will call the public discussion on tobacco regulations review to the plate right now. And We have a couple of folks out there in the audience now, so what I want to start by saying is the discussion tonight is exclusive to changes that we're proposing to our tobacco regulations that have already been approved to go into effect for January 1st. So we're not discussing anything about the tobacco regulations except those proposed changes, and I will review those proposed changes for you right now.
They're all
just so that-
highlighted here, right?
They're all highlighted, yes. So the first change is really administrative, and that is just that the header of the tobacco regulations represent the current Board of Health.
Members.
Oh, pages don't have numbers. All right, I'll
You
go-
need those little ones up top,
Top
right.
Ah,
Page 4.
Yeah.
The next change is simply a definition of smoke accessories. I will read that definition. Smoke accessories are equipment, products, devices, or materials of any kind that are intended or designed for use in ingesting, inhaling, or otherwise introducing tobacco product, marijuana, tetrahydrocannabinol, or cannabidiol, that's THC and CBD, into the human body, including but not limited to marijuana accessories, bongs, pipes, glass pipes, vaporizers, vape pens, hookah apparatus, dab rigs, pods, tanks, and cartridges. Again, all we're doing is defining what smoke accessories are. The next change is on page 6. Article E, Item 1. In the first line where it starts, "No person shall sell or otherwise distribute tobacco products," we're adding the words "or smoke accessories," as defined herein, et cetera. And then in item 3, under E, where it begins, "Each applicant who sells tobacco products," we're including the words "or smoke accessories." Page 8, there's an item H added called "Sale of Smoke Accessories," which reads, "The sale of smoke accessories shall be limited to individuals who are 21 years of age or older." On page 9, under the violations heading, Q, item 1, fourth line from the bottom and second line from the bottom, we're adding the words "and smoke accessories" in both cases after the words "all tobacco products," so that they read "all tobacco products and smoke accessories." And then the last change is on page 11, again, just simply editing the names of the board members to reflect the current board. So those are the only changes and the only items up for discussion tonight at this forum. In essence, what we're doing is we're defining smoke accessories. We're saying that only licensees that are licensed to sell tobacco products can sell them, and you have to be 21 to purchase them. So with that in mind, if anyone would like to speak.
Mr. Chair, if I can just
Yes.
add a point to the discussion.
Sure.
These regulations were sent out to our tobacco vendors by email twice, as well as our regional tobacco inspector went out for another purpose, but also for the purpose of making sure they knew about this hearing tonight, this discussion, public discussion. for
Thank
the
you very
record.
much. That's great, Mark.
One
Yeah,
little,
just-
oh,
No,
go
go
ahead.
ahead.
Go ahead.
No, you go.
KG.
Little clarification. So when they say sale about 21, that it assumes that the vendor checks the ID to do that, right? Okay. It's inherently.
In accordance with the tobacco regulations.
Okay, it's inherently assumed that it is
Mhm.
Yep.
verification.
Ron?
And it's just to be clear, when you say, one line down on page 6, you have "or smoke accessories," and then it says, "Without first obtaining a tobacco product sales permit," you're not making a distinction between actual tobacco and paraphernalia, correct? That's all incorporated.
It's all
in
incorporated.
one-
It's
Right, I don't know if
one
that.
license.
Right, because there's no separate tobacco product or paraphernalia license.
Correct.
So they're.
In our town, we don't have a paraphernalia
Okay,
license, so they
so
have to,
that-
they have to be a licensee to sell tobacco products.
Right, okay.
So with that in mind, if anyone would like to speak, please come up to the microphone and identify yourself and speak your piece.
Long time no see, Board of Health.
Hi, Mark.
Good evening. I'm Lou.
Just for the record, Mark, could you just
Mark
identify
Casoni,
yourself?
109 Hawthorne Road, Ashland, Mass. And I'm just curious, with what you just said, would this be after an established marijuana company or where it's gonna be business? This gonna be all established rules for what's gonna have to be followed?
Tell me if I don't answer your question. At the current time, Mark, the town of Ashland does not allow the sale of marijuana, either for recreational or for medicinal purposes. So this is irrelevant to the sale of marijuana.
Oh, then but it is a tobacco product. Byproduct.
What we're proposing, Mark, we're adding regulation to the sale of smoke accessories. These are devices. As I read the definition earlier of smoke accessories, what we're proposing is regulation on the sale of just those accessories in our town.
But those accessories can hold,
They can be used to do a number of things. We're not discriminating as to what someone buying those. Someone could use them to use as a planter, to use to smoke something, to do whatever they want with them. We're not discriminating or regulating what someone does with such paraphernalia. We're simply regulating that the purchase of such an item and the sale of such an item meet certain criteria.
okay, thank you. After it goes through the process here,
Mhm.
tell me if I'm wrong, would this have to go through town meeting?
No. No. After this meeting, next week, we as a board will take a vote on approving this addition to the regulation, and we will either pass it or not pass it, and it will take effect January 1st.
And this would be a policy, binding policy after the vote, if it
Yes.
passes or not.
It will be part of the regulations, the tobacco regulations of the town of Ashland.
Okay, thank you.
You're very welcome. Okay,
Okay,
okay.
happy that you're here. I have two changes.
Sure.
My name on page 1 and page 11.
Oh, you know what? They didn't make it on this version. On the version that
Okay,
I gave for us to sign, which we'll sign next week, I did make the change.
okay. And on the last page too?
Yep.
Okay, thank you.
Yep, no, yeah, that was something you had mentioned,
you.
and
All
I made
right.
that change, yes, thank you.
Okay.
Okay,
And maybe, just so the public knows, it's just the correct spelling of someone's name.
yes,
so
yeah, that was a correction to made on Judy's name that was incorrect in the original draft that we edited. Is there anyone else? Yep, go ahead, Judy.
So we don't have anybody here to speak against the changes that we're proposing.
That's correct.
And basically, the changes, there are only, so that the public knows, how many licenses to sell tobacco in Ashland?
17, right?
17 active and
17.
1 inactive at the time.
Okay. So, so there's 17 establishments in Ashland where you can purchase tobacco products. And the only place going forward you will be able to purchase the smoke accessory products are from those same 17 people, because if a store is a clothing store, they can't sell these if they don't have a license to sell tobacco. So that's the only change we're making, is that we're kind of putting it under the same umbrella within the store.
Yep.
Okay.
I'll make one final call for anyone that wants to speak on the proposed changes to the tobacco regulations. Seeing none, I'll declare the public discussion closed. And with that, I will ask if anyone wants to motion to adjourn.
If that's all we have?
Yep.
So moved.
I second
Second.
that.
All in favor?
Aye.
Thank you very much, everybody.